Hi, this is Emily Van Lith, Registered Nurse and Product Specialist for PHS Medical. I'll be introducing you to the epidural positioning device, or better known as the EPD. When we introduced the original EPD in 2001, we set a standard for patient and staff safety by providing a revolutionary alternative for assisting you in positioning patients safely and comfortably during epidural procedures and when performing other central anesthetic techniques. The EPD is currently in use in labor and delivery suites, operating rooms, pain management centers, and outpatient surgical centers all over the world. With our new electronic EPD, we have incorporated advanced ergonomics, increased comfort, ease of use, and given you the ability to execute faster and more efficient placements. Overall, the epidural positioning device increases your efficiency in thoracic, lumbar, and cervical placements by gently encouraging flexion while maintaining a solid and stable patient. Intuitive to use and easy to set up, clean, and move between rooms. Rethink patient positioning by improving safety and reducing risk with an epidural positioning device. On the left, you see the manual EPD, which is our original design, and the new and improved electronic epidural positioning device on the right. By electronic, it is an electrically charged battery. First, we'll break down the overall parts of the manual EPD, better known as the EPD Package 2. The reason we refer to it as Package 2 is that there's two moving components to this device. The upper portion of that being the epidural positioning device itself, which can be removed from the LDS on the lower half and secured to a surgical table. This picture shows you the electronic epidural positioning device. Again, you'll see that the moving parts are the EPD on the top portion and the LDS on the bottom portion. However, the top EPD is unable to be detached from the lower LDS. We'll start from the top down and look at the face rest first. You'll notice on the left that our manual EPD face rest is identical to the right-hand side electronic EPD. You'll also notice in the middle a box of our medical grade Sani covers. These face rests are encouraged with each use and change between patients to provide aseptic technique and infection control. Now moving on to the chest support and sternum pillow, you'll notice on the left-hand side, our manual EPD has a knob that is turning in the demonstrator's right hand and a push palm screw in her left. By loosening the knob on her right hand, she's able to move in and pull out the chest support with the push palm screw. On the lower portion of the left-hand side, you'll notice that she's moving the chest support up and down to best fit the patient with a turning knob. On the right-hand side, you'll notice that our electronic EPD is now controlled with ergonomic mechanical lock and release toggles. By depressing the toggle with her hand, the demonstrator is able to easily move the chest support in towards the patient and away from the patient with a nice fluid motion. You'll also notice on the lower right-hand corner that now as the chest support moves up and down, there's a more ergonomic friendly locking mechanism. Now as we look at the armrest, the left-hand side is our mechanical EPD, or manual EPD, and the right-hand side is our electronic EPD. You'll notice on the manual EPD that the armrest itself is slightly different than that of the electronic, and you'll also notice that there is a pull-pin locking mechanism to move the armrest itself up and down. On the right-hand side, the electronic armrest again features our ergonomic mechanical lock and release toggle for easy fluid motion up and down. The EPD height, as you remember in our previous slide, refers to the upper portion of the device itself. Please take caution when moving the manual EPD up and down, as it can be removed. As you look at the manual EPD, you'll notice that the motion to move it up and down is controlled by the EPD clamp handle. The clamp handle itself can be turned counterclockwise to loosen it and move the EPD up and down. The handle placement itself is also adjustable. If you lightly pull out on the handle, you can turn the handle out of the way of the patient's leg. On the right-hand side, you'll notice that the electronic EPD is now controlled with a remote. The remote is battery operated and adjusts the height of the EPD up and down very easily. We move down to the bottom portion of the device and see our LDS. Features the footrest. On the left-hand side, our manual EPD is adjusted with a pull pin locking mechanism. It's best to adjust this height by asking the patient to help move their feet up or down with you if able. On the right-hand side, you'll notice that now our footrest is adjusted with the battery-controlled remote. Looking at the brakes, this is our last component of the device itself. On the manual EPD and on the electric EPD, they both have 4 medical-grade caster wheels. The manual EPD has independent brake levers that both must be depressed fully to fully engage the brakes. On the electric EPD, the brake levers are interlocking. When one brake lever is engaged, both will be engaged at the same time. This table shows the differences in features overall between the manual EPD and the electric EPD. There is no difference between the face rest. You'll notice a slight difference in the chest supports as there's 2 cushion options on the manual and only 1 cushion option on the electric. Whereas in the manual device, there's push and palm screwing mechanisms. On the electric device, we now have upgraded to the ergonomic toggle locking mechanisms. On our armrests, you'll notice that the manual and EPD and the electric EPD shape is a little bit different. The manual has a pull pin locking mechanism, and again, our electric has been upgraded with our ergonomic toggle locking mechanisms. EPD height is a locking lever on the manual and is battery powered with remote control on the electronic EPD. The same goes for the footrest on both devices. This is the best feature of the electronic EPD, that you're now able to have a very ergonomically friendly and battery-powered motion. The brakes are independent of each other on the manual device and interlocking on the electric. In the lower right-hand corner, you'll notice an illustration of the footprint of the device overall. It's slightly larger on the electronic version, but only slightly. For shipping and handling, you'll notice that there's UPS and FedEx ground shipping within the United States for the manual version, and free shipping on the electronic. We do ship within the US, Canada, and internationally as well. Please call us for a quote on either device. We may be able to discount you if you're purchasing multiple units, or we may be able to offer you corporate purchasing. Which device is right for you? Call if you have more questions. 800-743-7738 or email Emily at pivotalhealthsolutions.com. I now invite you to click on our link to view a video for information and more instructional use on our manual and electronic EPD.